Good afternoon. My name is Dr. Julie White. I'm one of our equine internists here at Mississippi State College of Veterinary Medicine. Today we're going to be talking about the recent outbreak of equine herpes virus 1 that's occurring in the Texas area associated with a horse show in Waco, Texas. So we're still getting a lot of breaking information about this outbreak. But what we know is there are horses that have neurologic disease that have been at that show and have been positive for equine herpes virus 1, or EHV-1. And what's important is that we don't panic. This is a disease that can be, transmitted horse to horse, but it is not something that's transmitted across the geography, from Texas to Mississippi just by air, something like that, or birds. So if you have a horse that has been in the Texas area with those horses, or your horses around those horses that have traveled to Texas and those shows, then definitely talk with your veterinarian or chat with us about potentially boostering the vaccine for your horse and some preventive measures as far as biosecurity. We recommend those horses be quarantined for about 30 days on property. That way we aren't transmitting things around just in case they are positive. Otherwise, if your horse has, not been exposed, not been with those horses, not been around horses that have been out to Texas, the risk is still quite low. We do recommend, discussing the risks of, traveling to different shows. There are some shows that have already been canceled because of this outbreak. So communicating with the show management as far as what they're doing to mitigate the risk. And we can't tell you to not go or to go or make that decision for you, but just take into consideration, what you're doing and who you're going to be interacting with. If you have questions, we're happy to talk to you and send you some information. We do have some information on our social media linking to the American Association of Equine Practitioners, or AAEP, that discusses what you can do with quarantine and different steps to take.